Next up in our Cool Technology series is blood flow restriction technology. Here at the Jackson Clinics, we are constantly piloting new systems and trying out different options to see what works best for different patient types. In the world of blood flow restriction, research is coming fast and furious, so we're always on the lookout for new and creative ways to get the most for our patients while still respecting what the new research says is best. Today we're going to talk through two different types of blood flow restriction systems. The first one is called Smart Cuffs Pro. It digitally calibrates specific to the patient's limb, which gives us extra precision to calibrate limb occlusion pressure. That can be really useful because it allows us to restrict blood flow to a point where we can get extra fatigue at low loads. This can be great for tissue that can't tolerate high loads early in rehab. The potential negative is it's a single bladder air system, which does mean it gets super tight and can be uncomfortable for patients. The other system we'll talk about today is called a Be Strong system. The difference between this and Smart Cuffs is rather than a single bladder air system, this has multiple bladders of air. The reason that's relevant is even at super high pressures, it does not fully occlude arterial blood flow. In some ways that can be negative because it does take higher loads to get the same level of fatigue that we got with a Smart Cuff system. On the positive end, it can be more comfortable for the patient because there's not quite as intense fatigue. It's also better potentially for a safety perspective if the patient doesn't follow our prescribed exercise exactly. Another potential limitation of the Be Strong system is that it does not specifically calibrate to the patient's limb. Instead, you just pump it up to the desired pressure and then let them go exercise. The positive on that is it's disconnected and the patient can move freely. The negative is it's not quite as precise as the Smart Cuff system. Hopefully this BFR spotlight is helpful for you as you try to integrate new technology into your practice.